Our skin barrier can be weakened by external and internal factors such as pollution, UV, diet and lifestyle. Exposure to these influences, collectively known as the exposome, can exacerbate many skin conditions. With over 40 years of pioneering research into exposome skin health science, Vichy has developed solutions to support and protect the skin against exposome damage, as this report shows.
Dr. Mary Summerlad, welcome. Now, as a consultant dermatologist, you will know exactly what the exposome is, but for those of us who aren't quite so sure, could you clarify?
Aside from our genetics, which we can't help, the exposome is a lifetime accumulation of internal and external factors that influence us. Intrinsic factors include things like diet, alcohol, tobacco consumption, sleep, exercise, and external factors include things like UV radiation exposure from the sun, climate, and pollution.
So the exposome then, this lifelong exposure, our whole biography through to our biology, but surely we're protected through the skin barrier.
Well, it's interesting you mentioned that. Our skin barrier usually protects us and keeps the outside world out and the inside world in, but it is very vulnerable to the effects of the exposome. When our skin is affected negatively by exposome factors, the aggressors, we will notice a change in complexion. It may appear more dull, less radiant, and if you have an underlying inflammatory skin condition, you may find this easily exacerbated, especially if you have conditions such as eczema or rosacea.
So you mentioned rosacea. How is that particularly affected by exposome factors?
So rosacea is a surprisingly common inflammatory skin disease. It's thought that about 1 in 10 people of Northern European heritage will develop rosacea at some point in their lives. The hallmark of rosacea is a reddening of the skin, and although rosacea is present in people with skin of colour, the melanin, which gives the skin pigment, masks the redness, so it's often underdiagnosed. Rosacea, we don't fully understand what triggers it, but it's thought to be an abnormal blood vessel or vascular response that causes a reddening of the skin and edema, so swelling of the skin tissue. There can also be spots present as well as redness and broken vessels. We know that there are elements in the exposome that can worsen rosacea, such as sunlight and certain dietary factors. So it's really important that in rosacea, the skin barrier is very well maintained, that it's soothed and restored.
So for people who come to see you with this condition, rosacea, what do you recommend? What do you say about how they should look after their skin?
So first of all, I highly recommend a simple skincare routine using skincare products that really target the areas of the exposome that can be modified. One of the brands I work with is Vichy, and they're really pioneers in the area of addressing the exposome concerns. So look for products that contain ingredients that restore and soothe the skin barrier. These include products like niacinamide, antioxidants such as vitamin C, and hyaluronic acid, which helps to retain moisture within the skin.
So it's an exciting and pioneering area. What excites you about working in this field in terms of being able to help the people who come to see you?
I think the most exciting and important thing as a dermatologist is improving the quality of life for our patients. I think the future is very optimistic for people with inflammatory skin conditions because there are now targeted products that can help soothe the skin, because a big problem in rosacea is sensitivity and highly reactive skin and a skin barrier that can be very easily damaged. So now we know that we can target those areas. I think the future is very bright and we can hopefully have people who are able to manage their condition much more happily.
Dr. Mary Summerlad, thank you very much.
Thank you.